I'm Dr. Grace Percalipicorn. I'm an assistant professor of ophthalmology at the Duke Eye Center. I'm a pediatric ophthalmology and strabismus specialist. A cataract is a cloudiness or an opacity of the natural lens of the eye, which is normally clear. While most people develop cataracts as they get older, some infants are born with a cataract or develop them at an early age. About 3 in 10,000 children have a cataract, but this number varies worldwide. There are many different types of cataracts. Some cataracts are small and they don't affect your vision. Other cataracts can be large and they can cause severe and permanent visual loss. So let's take a closer look at the eye. So for a child to develop normal vision, light rays need to be able to enter the eye and focus on the back part of the eye to send a clear and focused image to the brain. When a cloudiness of the lens or a cataract forms, these light rays may be blocked and unable to focus on the back of the eye. If this occurs, a child may not be able to develop normal vision. Your child's eye doctor will recommend a surgery to remove the cataract. When a child is missing the normal lens of the eye, they are considered aphakic. In order to visually rehabilitate the eye, aphakia is usually treated using glasses or a contact lens, which focuses light on the back of the eye and promotes visual development.
Hi, I'm Yas Priestley. I'm a pediatric optometrist here at the Duke Eye Center, and I work with patients and their families after they've had cataract surgery to help fit their contact lenses. It is extremely important that you always remember to wash your hands thoroughly and dry thoroughly prior to handling the contact lens. Let's start with having the child nicely tucked in, either from being swaddled by blankets or having a caregiver carefully hold onto the child so that their arms and legs are secure. With our clean hands, we first start with placing our non-dominant hand over the child's forehead. The thumb should be pulling up on the child's upper eyelid. The rest of the hand keeps the child's head secure. The reason why we have our hand here is to ensure that the child's head is steady while we are trying to insert the lens. You do not have to pry the child's eye wide open. All you need is a small opening or pocket. With your dominant hand, you will slide the contact lens underneath the upper eyelid, parallel to the surface of the eye. Sometimes the lens does not go underneath the top lid fully. Be sure to pull on the lower lid to allow the contact lens to drop into place. Once you have safely inserted the lens, be sure to look at your child's eye to ensure the lens is truly in place. When removing the contact lens, again, make sure the child is secure and that your hands are stabilized on their head to prevent sudden movements. Do not place your finger away from the eyelashes as you pull up, as you do not want to turn the eyelid inside out as you try to remove the lens. With the top lid secure, pull down on the bottom eyelid, again, being sure to keep pressure against the eye to avoid turning the eyelid inside out. Once you have both eyelids pulled away, gently apply pressure at the 12 and 6 o'clock positions to dislodge the contact lens. Common mistakes when removing a contact lens include not pulling the eyelids far enough apart before you apply pressure to remove the lens. You should be sure to expose the 6 and 12 of the lens first, and placing your fingers too far back from the eyelashes, which causes the eyelids to turn inside out. The next thing I'm going to show you is how to clean and disinfect your child's contact lenses. I'll begin by showing you how to disinfect a contact lens with multipurpose solution. Place the lens in the palm of your hand and apply several drops of solution, disinfecting solution, as prescribed by your doctor. You'll need to rub the contact lens using the soft part of your finger to mechanically clean the surfaces. About 10 seconds. You'll then place the contact lens into your case with fresh solution. And store it for at least 4 to 6 hours to disinfect. To disinfect your contact lens with the Clear Care system, you'll open the vial and fill it to the etched line with the solution, the Clear Care solution. This solution never goes directly in your eye, it only ever goes in the vial. To be neutralized. The contact lens will then be placed into the clear care vial cage. The cage flips open, the contact lens is placed on top of the dome, and the cage is flipped down. The vial is then placed into the clear care solution and soaks overnight for at least 6 hours. It's very important that the lens stay in there for 6 hours to allow the solution to fully neutralize. The lens can then be placed directly from the cage into your eye. If you are experiencing any of the following issues, please call us during regular clinical hours. If the contact lens is popping out frequently, if your contact lens is lost or broken, or if your child is uncomfortable with the contact lens, please remove it and give us a call when we are open. If your child is experiencing any of the following emergent issues, such as their eye is red, inflamed, and does not resolve after a short period of time of contact lens removal, or if you feel that your child might have scratched their eye while inserting or removing the contact lens, this may look like a red, watery eye, and your child may keep their eye closed or covered with one hand, please call us immediately and request the doctor on call. Please do know that we are here to fully support you through this process, so if you ever have concerns or questions, do not hesitate to call the clinic. Finally, a few tips. Remember, practice will make perfect, so keep working on your technique and don't be discouraged. You can work on the lens for 10 or 15 minutes at a time, then take a break and return to it. If you are having trouble keeping your child steady during lens insertion or removal, you can try swaddling for an infant or a bear hug for an older child. It can be helpful to keep your fingernails trimmed short while working with the contact lens. It is very important that you continue using the contact lens as prescribed by your doctor. So please do not hesitate to call the clinic if any concerns or questions arise. Remember, we are here as a resource and to support you through this process.